This morning, we're learning more about a bold new plan to wipe out hepatitis C in the U.S. The CDC estimates more than 2 million people in this country have hepatitis C. The virus kills more than 15,000 Americans every year. That's even though the disease is curable after breakthrough treatments were approved a decade ago. But the high cost of treatment is a big obstacle for many patients. CBS News chief medical correspondent Dr. Jon LaPook got an inside look at the White House initiative.
So one day I started itching. Like really bad.
When William Glover Bay was diagnosed with hepatitis C in 1992, he never imagined what his doctor would tell him 24 years later.
He said, "William, your liver has cirrhosis."
Although Glover Bay was aware he had the virus, many are not. About 40% of the more than 2 million Americans infected with the virus are unaware they have it, and that's contributed to new infections spreading.
This is a silent killer.
Dr. Francis Collins was director of the National Institutes of Health for 12 years.
When you first get the virus, you may have 5, 10, 15, 20 years of feeling pretty normal. Meanwhile, that virus is doing its damage.
That damage can include liver failure and liver cancer. The virus is usually spread through contact with blood from an infected person. But there's hope. In 2013, a new generation of oral antiviral drugs was approved that could cure hepatitis C.
1 pill a day, 12 weeks, almost no side effects, 98% cure rate.
One obstacle? Treatment costs tens of thousands of dollars.
At its core, is this largely a health equity issue?
This is a health equity issue. These are often people on Medicaid. They may be people who are uninsured.
After leaving the NIH, Dr. Collins became the acting science advisor to President Biden and approached him with a bold proposal to eliminate hepatitis C in the United States.
If we could get access to the drugs for people who are infected, we calculate in 10 years, you would save the federal government $13.3 billion in healthcare costs that we wouldn't have to spend. Liver transplants, liver cancer, liver cirrhosis. You have saved billions of dollars and tens of thousands of lives. What's not to love here?
In March, President Biden gave Dr. Collins his answer.
Okay, we're on it, do it. And by the way, Collins, you're in charge.
How did that feel?
Good. I'm obsessed about this.
To help drive down the cost, Dr. Collins pointed to a program implemented in Louisiana as a possible model. It began with the support of Republican Senator Bill Cassidy, who happens to be a physician who has treated people with hepatitis C.
The goal was to use a subscription model. We call it the Netflix model. You pay a flat fee to the drug company, get as much drug as you can, and you treat as many as you can. That was going to be principally for the Medicaid, the uninsured, and the incarcerated population.
And how did that actually roll out when it was tried?
Yeah, it rolled out pretty well, and then the pandemic hit.
After the program began in July 2019, the number of people beginning treatment increased dramatically, from 288 in the first 3 months to 1,584 in the next 3 months. Even with the pandemic slowing treatment, the total number of patients treated has grown to more than 14,000.
That is possible, that you can treat a lot more patients than you've previously treated if you take the cost of the medication, if you eliminate that as a barrier.
President Biden has proposed spending $12.3 billion over the next 10 years to help eliminate hepatitis C. But congressional support for that initiative will depend heavily on a pending analysis from the Budget Office.
Good policy is good politics, but everybody in Congress knows somebody with hepatitis C. If the administration comes up with a good plan and it can justify what it's asking for, and we can show success elsewhere, I'd like to think that we can go to members of Congress and get buy-in.
For William Glover Bay, treatment of his hepatitis C in 2016 helped turn his life around. Having likely contracted the virus by sharing needles, he's now healthy and drug-free, married, has 3 children, and is a community health worker for Johns Hopkins Medicine in Baltimore.
Well, you may be one of the soldiers in the future who go into the community and say, hey, let me tell you what the story is. Because, you know, hearing it from the head of the National Institutes of Health is one thing. Hearing it from a community leader who's been there is another.
And I'm a willing participant. I give back every day. that's what my job is, to get back.
If a plan is funded by Congress, it would expand testing, broaden access to powerful antiviral drugs, and boost awareness. Dr. Collins told me he's hoping the administration and Congress can join together to support a program he says will save billions of dollars and tens of thousands of lives. His exact words to me were, "How can we not do this?"
Seems like a no-brainer, Dr. LaPook. But yet, one of the interesting problems, though, is that 40% of Americans aren't even aware that they have hepatitis C. Yeah. So why is that?
I think, yet again, I know I talk about this all the time, this is a health equity issue.
Yeah.
If you're black, if you're brown, if you're underinsured or uninsured, you're much less likely to get tested and certainly less likely to get treated. The CDC has said everybody age 18 and above one time in their lifetime should get screened for hepatitis C, and every pregnant woman with each pregnancy, with rare exceptions. So I think clinicians have to be more aggressive at getting out there and really making sure this gets done.
I don't know if I've ever been screened for hepatitis C. You think I have?
I suspect you have.
If they take blood.
Dr. Jon LaPook is my doctor, so maybe he knows something I don't. But
Not
listen,
to worry.
It does seem like Dr. Collins is the right person for the job. I love someone who says, I'm obsessed with this.
I'm
Somebody
obsessed.
who wants to get it right. Didn't that strike you?
Yeah.
I'm obsessed with this.
He's the right man for the job.
He did the Human Genome Project, everything. I've never seen him so compassionate about something. He wants this to get done. He wants Congress to get this done.
Yes.
Right man for the job. Absolutely.
Thank you, Dr. Jon LaPook.